One of the current problems with many drugs that are taken orally is they only work for a limited time because they are broken down and pass quickly through the body. Another problem is simply getting patients to take the medicine day after day. In some cases, regimens require repeated doses in order for the drug to be effective.
So, the biggest issue with taking medication is that folks just don't take their medication. And in fact, only about 50% of folks actually take their medication as prescribed. And I think really at the heart of the matter is that it's tough sometimes to remember to take that medication. And so really, one of the things that we set out to do was to make it easier.
Having a way to safely and gradually release drugs in the human body over an extended period of time could have a profound effect on eliminating certain diseases, such as malaria. In an attempt to combat the obstacles involved in effective long-term drug delivery, a team of researchers at MIT and Brigham and Women's Hospital has developed a new drug capsule that remains in the stomach for up to 2 weeks after being swallowed, gradually releasing its contents over time.
So the dosage form that we developed looks like a star. And I think it's important to appreciate the different elements of the star. And so we have arms, and then we have a central elastic portion. The arms are rigid, and they are the ones that are loaded with drug. And the central portion is elastic. It enables essentially the folding of that star into a capsule.
Once swallowed, acid in the stomach dissolves the outer layer of the capsule, allowing the star's 6 arms to unfold. Once fully expanded, the star, due to its shape, size, and material properties, is able to resist forces that would normally push an object further down the digestive tract without causing any harmful blockages in the stomach or intestines.
The GI tract is an interesting organ in that it's really a long tube that has a couple of segments that are a little bit dilated or bigger. Specifically, the stomach is a bigger segment. So there's actually an incredible opportunity to house in the GI tract a depot or a storage of the full dose of treatment, for example. And as long as we're able to control the release of that treatment, of that drug, we may have the capacity to essentially deliver the full course of treatment and then by some engineering, have that drug be delivered over the course of days, weeks, or potentially even over months.
The researchers say this device is more of a platform into which you can incorporate any drug that requires frequent dosing. They are now working on developing similar capsules to deliver drugs against other tropical diseases, as well as HIV and neuropsychiatric conditions.